Welcome to Friday's edition of COVID-19. Authorities across the globe are working around the clock to contain an unsettling surge in cases. Curfews and other restrictions are in place in Europe, with the global health body calling for tough containment measures and greater public support in stemming the spread. I have our consul starting today with the latest on the international front. So the world has recorded, and correct me if I'm wrong, over 380,000 cases in a span of roughly 24 hours.
That's correct, but it always depends on from which country you count the numbers, but that is correct. It was a record high in daily cases, meaning roughly 1% of the total accumulation around the world. And if we take a look at the latest tally as of noon Korea time, we have over 426,000 new infections, so that would be another record high in terms of the 24-hour span, according to Korea Standard Time. And we also have over 6,000 new fatalities, raising the death toll to over 1.1 million, and we have almost 29.4 million recoveries. And this fast rise in cases is attributed to many countries in the world still dealing with second wave of the pandemic, and that also includes Europe. And that is also why, especially in the case of Europe, the World Health Organization expressed its deep concern over the exponential increase in daily cases as well as daily deaths. And in fact, it looks like in Europe, the fifth leading cause of death is the coronavirus. And also officials have been mentioning that there is a lack of hospital beds due to this recent surge. So here's an official from the WHO expressing this concern and calling for more efforts on European countries.
We should not hold back. So the key message here to the governments is do not hold back with relatively smaller actions in order to avoid the same very painful and damaging actions we saw in the first peak round.
So let's take a closer look at the figures abroad, and let's start with European countries, which thought in many cases that the worst has been overcome, but that is not the case with Russia, Spain and France as well. These countries are still seeing tens of thousands of new infections on a daily basis. And the same goes with the countries from the US until Argentina. Those are the countries that are seeing more than 10,000 cases in every day, and the US and India reported 66,000 and 60,000 new infections in the past day. And now let's move over to our next table, where we can see the UK has reported the highest number of new infections with over 18,000 there. And also in Europe here, Germany, we can see has become the country with the 19th highest number of infections in the world. Again, another spot above compared to yesterday, reporting some 7,000 new infections.
I see. So here on the domestic front, I understand we're seeing slightly less gloomy numbers for today.
Right, Sunny. With 47 new cases reported this Friday in Korea, the number dropped to below 50 for the first time in 17 days. So with that, the total number of COVID-19 cases here domestically stands at 25,035. The death toll stands at 441, with 2 additional fatalities reported in the past day. And some 1,400 people are in quarantine, 53 less compared to yesterday, and almost 100 new recoveries, raising that total to 23,180. And if we take a look at our graph now, we do see this 8-span graph here from last Friday to this Friday. Not a big change in the number. We do see a slight drop, but we did have some triple-digit figures this week as well. So the average during this span is 78. And now by region, we see that the capital Seoul reported 18 new cases, followed by 17 in Gyeonggi-do province and 4 in Incheon. So most cases are still concentrated in the metropolitan region, and we also have some sporadic infections in other parts of the country. So we do see that actually there has been a decline in provinces and cities affected around the nation, which could tempt citizens to enjoy the beautiful autumn foliage here in Korea. And that is why on the map in the northeastern part of the the city, although we do not see it right now. This is the region where the fall foliage actually begins, and that is why authorities are really concerned because they have designated a 1-month special antivirus period starting tomorrow aimed at preventing new spreads during this span, especially because people like to travel through the country and go hiking as well. But even outdoors, it is recommended or actually required to wear masks now due to the COVID-19 situation. So please keep that in mind this weekend and beyond. And we do not have an afternoon briefing by the government on the COVID-19 situation today, so I will be back with more updates next week. Back to you, Sunny.
All right, so thank you for that. Have a safe weekend then.
Thank you, you too.
Right, staying on the local front, relevant officials here are making public pleas for blood donations given the challenges in securing supplies amid the pandemic. I have our Chun Song-cho with me up next with details on that. Hello, Song-cho.
Good afternoon, Sunny.
Song-cho, so I hear you are at a blood donation center here in the capital city.
Yes, I'm at the Isu Center in Dongjakgu District. Now, the South Korean government has been urging healthy individuals to donate their blood as much as possible, basically all throughout this year, with major blood donation drives canceled due to the COVID-19 pandemic and the country's blood supply at a potential risk. Now, Korean Red Cross considers an optimal reserve when there's more than 5 days worth of blood supply available at all time. However, that inventory level has dropped lower than that to as low as 4 days worth of blood supply. As you can see here, it is at a very critical level, and there are all these different types of blood that are in need, and blood type O is in the most critical need. We need about 5,600 donors on a daily basis to ensure the steady supply of blood. However, we are only seeing about 5,000 people turning up at the center these days, at the centers nationwide. And what's really concerning is that the low donor participation can really harm blood availability at hospitals. And the last thing a patient should worry about is whether life-saving blood is on the shelf when they need it most. Surgeries that need blood can be delayed, and patients won't be able to recover, and that is something that we do not want to see. Absolutely. So the center is doing everything in its power to make sure that this place is the safest place as possible so that people can come here without having to worry about accidentally contracting the virus. So they have implemented several safety measures, including employees always wearing gloves and masks. They're using sterile collection sets for donations, and they're also disinfecting the entire center as frequently as possible. And of course, donors have to get a temperature check and apply hand sanitizers as well in order to enter the center. Now, like I said before, we need as many people as possible for donating blood. And since I'm right here, I might as well get a test if I'm an eligible donor. So follow me. 안녕하세요. So I need to have my hemoglobin level checked. 네, 안녕하세요. So she's going to poke a needle on the tip of my finger to get a very small drop of blood. Ooh. Oh, that didn't hurt at all. I was really worried, actually, because I have a bit of a needle phobia. So she's getting a sample of my blood, and ooh, that's a lot of blood. But it doesn't hurt. It didn't hurt, I promise. So she's putting the sample of my blood into the machine to get my level checked. Actually, to ensure that I'm a safe donor, I need to have a minimum 12.5 grams per deciliter and a maximum of 20 grams per deciliter. So 얼마나 나왔어요? So I have about 14 grams per deciliter. So I am an eligible donor. That's great. Well, the blood supply is something that we cannot take it for granted, and the coronavirus is only heightening the need for a ready blood supply. And let's remember that we need everyone's participation to ensure that we have a stable flow of blood supply, especially at this really challenging time. This has been Chun Sung-cho from Isu Center, and back to you guys in the studio.
All right, Song-cho, thank you very much for that, and thank you for putting aside your needle phobia for this coverage.
Children from 10 to 19 transmit the virus as effectively to adults as adults transmit it to adults.
In today's studio session, we take a look at the impact of COVID-19 on our children and on our companion animals. Now, granted, research has yet to draw conclusive results as studies continue, but I have our Dr. David Kwak from Soonchunhyang University Hospital with me to start us off with the general knowledge so far. Dr. Kwak, as always, thank you for making the time to join us here at the studio.
My pleasure.
Dr. Kwak, children are believed to be less vulnerable to COVID-19, and even when they are infected, they appear to show little to no symptoms at all. What are your thoughts on this phenomenon?
Well, so I wanted to make a reference to a study that was done a few months back in regards to specifically the angiotensin converting enzyme 2. In short term, it's called ACE2, and it's now known that the virus is attached to those specific enzymes to enter our human body. From a couple of studies, it was hypothesized that from actually in reference to even former studies, it was found that as we age, we are getting less expressions of ACE2 in our body. So meaning children tend to have higher levels of ACE2 expressions in their cells, and adults, especially getting older, let's say 70s and 80s, they're having much, much less of those expressions. Now, having said that, this particular study I want to refer to was hypothesizing that children who are with abundance of ACE2 would get same amount of infection, but would actually show less of the symptom, because adults, as a compensation to the lack of ACE2, are having more and more cytokines and other factors in the pathways of inflammations to compensate for the lack of ACE2. So for the same amount of virus that gets into the body, let's say for children, they seem to show much less of the symptom because there are abundance of balances in the cytokines. But within adults, because there are so much more cytokines and more inflammatory pathways to take on for the lack of ACE2, they're showing much more symptoms from the same type of virus infection.
I see. Dr. Kwak, now despite their relatively mild symptoms, when infected, these children have been found to carry heavier viral loads than hospitalized adults, making the former much more contagious. Can you tell us a bit about this then?
Well, I cannot make a formal statement as to they would actually, for the fact that they would actually either spread much more or not. But it seems like we would also have to take into consideration our daily activities and our social life activities. So in comparison, adults would obviously be more able to contain themselves and not come into contact with other people. But in the demographics, I guess younger children, especially in their teenage years and whatnot, they would be much more vulnerable to becoming or actually coming into contact with other peers, and they would much more easily spread to others. So it's also likewise in regards to inter-age group relationships, because children, let's say, who are not able to contain themselves would actually just run to their grandmothers and grandfathers and pass on to them, as opposed to grandparents being worried about for their grandchildren would tend to contain themselves from it. So I guess that's another factor we could also take into consideration.
Right. Now, for more on the role of children in transmitting COVID-19, I have Dr. Ramanan Lakshminarayan, a senior research scholar at Princeton Environmental Institute, live on the line from India. Welcome, Dr. Lakshminarayan.
Thanks for having me.
Now, Doctor, before we touch upon your research, perhaps we could start with the overall situation of COVID-19 in India, which is the second hardest hit nation after the US with more than 7.3 million cases. Would you happen to know how many of these cases affect children there?
So India has a lot of cases, primarily because India has a large population and the disease has spread quite widely across the country. We don't have good data on the proportion that are in children overall because the 7.3 million number that you referred to are reported cases, people who got tested, and children in general, as Dr. Kwok just said, don't show symptomatic infections and therefore are far less likely to be tested. So they might not show up in the testing, but they may be efficient transmitters of the disease.
I see. Doctor, I understand your study shows the role of children in transmitting COVID-19 may have been underestimated. Would you care to elaborate, please?
So in a study that we published in Science magazine, which I guess is the largest COVID epidemiology study to date, based on contact tracing, with about 85,000 primary cases and 575,000 contacts. In fact, the second largest study is actually from South Korea. What we found was that children are efficient transmitters of the disease. They are far less likely to be index cases because they're not tested. But once you test someone who's a child and then you look at their contacts, the probability of them infecting someone else is no different, particularly for the over 10 age group than adults. So it is a mistake to think that children don't transmit COVID. It is certainly true that children are less likely to be symptomatic or suffer from adverse consequences of COVID.
I see. Dr. Kwok, I understand you may have a question for Dr. Lakshminarayan.
Sir, thank you for sharing your valuable time with us today. I would like to ask one question to you, sir. So according to your study, it seems like the study is implicating that it is higher for the same age group to actually spread against to each other than to other age groups. Could you explain on that?
So, Dr. Kwok, so what we found was that in all age groups, the probability of spreading to someone of that same age group was pretty high. Now, this was unexpected because in India, people live in multi-generational households. So there might be the grandparents, the parents, the children, all living in the same house. So one might think that people might infect all the other age groups the same way. We didn't find that to be the case. So the elderly are far more effective at infecting the other elderly because they probably spend a lot of time with each other. And children actually primarily infect other children, which is surprising because during the period of the study, schools have been closed across India. So the opportunity for children to infect other children was not nearly as much as if schools had been open. But certainly they pose a primary infection risk to other children, but they certainly spread the disease to other age groups as well, although at a lower probability.
I see. Dr. Lakshminarayan, I took the liberty of reading up on your study, and do correct me if I'm wrong, but your study seems to suggest that transmission is high within the household, and some have been advocating the reopening of schools, underscoring this precise point. But if children are more likely to contract COVID-19 from their peers, then surely schools are no safe zones. What are your thoughts on this?
That is a great question, and one that there is no easy answer to, because we have to balance the risk of transmission in schools with all the benefits of schools, which are that, children need to have an education and they can't spend the entire year at home. And particularly in countries like India, where remote learning is an option for many people, but not for everyone, because not everyone may have a smartphone. But that said, children do transmit to other children. And within the household, the risk of transmission is about 1 in 10. So it's a 1 in 10 probability that if you lived with someone who was infected, that you would get it from that person, almost identical to what South Korean studies also found and other studies have found. So it's a very similar sort of a phenomenon. So your risk of transmission within the household is actually not that high. we don't have good estimates of risk of transmission in schools at scale. But I would imagine that, as you said, it would be probably higher because children by nature cannot do social distancing. They hug each other, they're close to each other, and it's difficult to expect them to behave like adults and keep distance. So I think almost certainly the secondary attack rates, in other words, the probability of getting it from an infected person in the school would be far greater. But like I said, the decision on whether to open schools or not must involve many other parameters, and COVID is just one of them.
Right. Doctor, your study in essence also shows that the spread of COVID-19 is essentially driven by only a small percentage of those who are infected. Could you tell us more about this, please?
So in our study of the 85,000 primary cases, we found that 71% of them did not transmit the virus to anybody. Of the remaining 29%, they transmitted, to the entire population, and 8% were responsible for 60% of the secondary cases. So it's a very small number that is responsible for what we call super spreading. Now, super spreading is not necessarily one person giving it to 50 people in a crowd. It may just be that one person is giving it to 5 other people, whereas most people don't transmit to anyone else.
I see. Doctor, one final question before you go. What measures are in place perhaps in India to better protect the young from COVID-19, if there are any?
I think it's the same procedures as everyone else. The schools have been shut. They've not opened up yet. There's still a lot of discussion. The central government, the national government has allowed schools to open, but it's not happening across the country. I think the primary method has been to keep them at home. There is a lot of emphasis on mask wearing and hand washing, because at the end of the day, that's what any country can do. We don't have many tools to deal with COVID. That's the unfortunate situation, whether it's the United States or Korea or India.
All right, Dr. Lakshmi Narayan, thank you very much for making the time to join us live at this hour.
Thanks for having me.
Right, Dr. Kwak, earlier this week here in Korea, there was a cluster infection at a daycare center in the city of Daejeon involving at least 4 toddlers below the age of 2 and 4 staff members. Now, toddlers are discouraged from wearing face masks. What ways then can we keep them safe from COVID-19?
Well, I would like to first mention that it's very unfortunate that it actually happened. But as we all know, it's really hard to keep the toddlers away from actually socially interacting, especially with the masks. It's almost impossible. I have a 3-year-old at my home. He's almost impossible to actually keep the mask on. But that being said, some of the things I think that can be done is ventilating. Number one, because it spreads through a confined space, it spreads much faster in a confined space. I always tend to, but I always leave all my windows open in my home, when I'm at home. That is something that could be considered. I know it's getting cold, so maybe have the toddlers wear heavier clothing and still leave the windows open to have the air ventilate through and have the much cleaner air come through. Number 2, it's also possible that this virus is not only spread through respiratory droplets, but also through water droplets, such as from saliva. It was a few months back when a study hypothesized that because children were showing viral load much higher in their saliva and in their feces, they were hypothesizing also that it could be possible for the children to be spreading the virus through touching the saliva as much as fecal matters. So I guess in that sense, we could also focus on washing hands very often. I guess we can mandate all these toddlers to wash their hands every hour or even less, much more frequently than the adults. And so that could be 2 possible alternatives to having masks on the toddlers.
Right, ventilation and of course getting them to wash their hands. Mm-hmm. Right. Now, along with our little ones, quite a number of us across the globe have at least one animal companion to take care of. And for more on the impact of COVID-19 on our furry friends and others, I have Professor Michael Ward from the University of Sydney. Good to see you again, Professor Ward.
Good to see you, Sunny.
Professor Ward, I understand that there has been a number of studies showing that pets like dogs and cats can also get COVID-19. Are there any animals that are particularly vulnerable to contracting the virus?
That's a very interesting question, Sunny. if we step back, I mean, all animals really, we found coronaviruses. They're widespread. Almost all species where we look at, there's coronavirus. It's good to note that most of those do exist in bats, and that's why we think, bats are going a long, long way back, are probably where these coronaviruses originated. But if we look at our current situation, certainly pets, so dogs and cats, we have found coronavirus and the novel coronavirus in them. We also have found it in some zoo species. So there's been cases of coronavirus in lions and tigers. In Europe, they've had a problem with farmed mink. So there's been spread of coronavirus there. And also in some of the laboratory species that have been used as models for research. So particularly ferrets, they transmit coronavirus quite readily. But in terms of our pets, it seems the early data is that cats are the most susceptible to coronavirus. There have been documented cases in dogs, but it seems cats it's more common. There was one early study in Hong Kong where they looked at households in lockdown for a coronavirus case in humans. 6 out of 50 of the cats in those households they found were infected with coronavirus. So it seems that cats are the most susceptible for coronavirus and also show signs.
I see. And what signs do these cats show, or animals in general, when they are infected with COVID-19?
They're not necessarily that dissimilar to humans. It's that respiratory signs, particularly sort of nasal infections. We see pneumonia as well occurs. Perhaps a little bit different to humans, I'm not quite sure, but we see conjunctivitis, so that's an infection around the eyes. But it can be inapparent. We might see nothing. It might be mild. It looks like there is a disease called cat flu, which is different disease, but similar sort of signs. But it can also be severe. So that sort of does suggest that it's cats. And also I mentioned those cases in zoos. They've been in tigers and lions. So it seems like felines, for some reason, are more susceptible to this virus than other animal species.
I see. Professor Ward, I'm sure research is still ongoing, but do we know why cats are more vulnerable to COVID-19 than dogs, perhaps?
No, I don't think we do, and it might relate to what we were discussing before about the receptors. Maybe they do have more AC receptors. I'm not so sure. There's this other issue with pets, of course, it's the interaction with humans. It's really important to note that all these cases, so far, it's been the human giving the infection to the animal. Now, whether cats are more susceptible than dogs, or whether just cats are spending more time with their owners, the closeness of the interaction, that might explain it. Really, a lot of research has to be done to work out why it is that cats seem to be more susceptible than dogs.
Right. Dr. Clark, as Professor Ward has just mentioned, men appear to be responsible for the cases of animal infection with COVID-19. Have there been any known cases of animals transmitting COVID-19 to human beings?
I believe, to my knowledge, I don't think so, but I could be wrong. So we would have to look deeper into further studies. I also just wanted to mention one thing, though. There was a particular study done also a few months back that compared similarities and disparities between ACE2 enzymes of different animals, including that of human and monkeys, ferrets, cats, and whatnot. And they found actually ACE2s of cats and ferrets to be very similar to a human being as compared to dogs and other animals that were quite different from human beings. So I think that could be one factor why it's easier to find cats and ferrets that are infected with this COVID-19. But I don't think there was any particular incidents where an animal actually went ahead and infected a person yet.
Right. Professor Ward, what are some precautions then that pet owners can take to keep themselves and their pets safe from COVID-19?
Yeah, I mean, this is very similar to the discussion just before about toddlers. I guess you could think of pets as toddlers. Very difficult with toddlers, very difficult with pets. It's really isolation. So how do you isolate yourself from your pet? And the reason we have pets is that close bond we have with our pets. So very difficult. You would probably isolate if possible. Generally, what's been done is the pets and the people are considered to be one unit. If you're in isolation, it's you and your pet, you just stay there. One thing is we don't want pets being moved between locations. Another issue early on when there was this suggestion that animals could be infected, people were abandoning their pets, and that was very counterproductive. So we had pets just being abandoned, which just causes more problems. There's no need for that. It's very likely almost in all cases, the pets have received or got the infection from their owners. So there's no reason to do that. Essentially, it's just isolation. Do not move pets from one household to another. And really, that's about all we can do. So it's very similar, I guess, to the toddler situation. We could approach it in the same way.
I see. Professor Ward, were there any measures in place to deal with the abandonment of animals, pets?
Yes, I don't know. I mean, it did cause a lot of problems. So when you're trying to fight a pandemic, that's the last thing you want, is to try and deal with all this, these issues of abandoned pets, because they can cause more problems. There's also been some studies looking at stray cats and dogs, and I think from memory they have found some infections. Again, we don't know whether that's an important sort of potential reservoir of the virus or not. So we certainly don't want a lot of pets entering that population and causing the problem, making the problem even worse.
Of course. Dr. Kwok, there has reportedly been a surge in the influx of animal companions from China into Korea this year, but despite concerns over the pandemic, their tests for biosecurity risks do not include COVID-19. What are your thoughts on this? Or are you in favor of perhaps stringent screening measures for these animals?
I definitely am pro more stringent tests on these animals. We have seen that. For instance, just a few months back, we were having huge problem with pigs and cows getting the virus actually possibly from China. It has to be the same treatment for our pet animals because they're pretty much the same. We share the same space and we share the same virus. I do think any animals that are to be imported from not just China, but any foreign countries has to go through the same measure of testings and screenings as to minimize the possible risk of infection and infection to human beings.
Right. Professor Ward, I hear Australia has some stringent measures with regard to the entry of animal friends into the country. Could you tell us more about this?
Yes, because we're an island continent, we've always had very, very strict quarantine regulations. And ironically, a lot of that is to prevent the incursion of rabies into Australia. So the way of doing that is having a very, very long quarantine period, months and months. Because of that, as far as I'm aware, there's been no changes in the entry of animals. We have this really long quarantine period, which would prevent the incursion of coronavirus by pet dogs and cats. So ironically, that's been in place for a long time and really hasn't been changed and hasn't needed to be changed because of those restrictions. The only exception is dogs and cats from New Zealand. And New Zealand is, as far as we know, doesn't have coronavirus at the moment. So in terms of the importation of dogs and cats, it can still occur because they go into quarantine.
I see. Professor Ward, there's been a lot of talk about the psychological impact of COVID-19 on senior citizens, on people in general, of course, across the world. Do you see pets as perhaps providing people a sense of understanding or sympathy amid the pandemic?
Yeah, I mean, it's very important, and it sort of highlights how this is a whole. We have to look at this problem sort of from a bigger perspective, and the mental health and well-being. It's been very well demonstrated that pets, and particularly in places like nursing homes and retirement homes, they're very important. Balancing that against any potential in transmission of coronavirus, I think really it's the benefit of having pets. I mean, far outweighs any risk, because at the moment we really can't find any risk. I mean, sure, in the future someone might identify one case where a pet has infected a person. We haven't seen it yet. If it does happen, it'll be so rare in terms of the human-to-human transmission. Really, I think the benefit from pets are a lot higher than the potential risk of infection. That's for sure.
Professor Ward, yesterday in the studio we touched upon habitat destruction and how its role in creating infectious diseases might have created the pandemic. I'll explain that for you. It's because of habitat destruction we have disease-carrying animals coming closer to human beings, providing these viruses perhaps with new hosts to thrive in. What are your thoughts on this?
Yeah, I mean, and that has been that idea has been around for a long time. There's some good examples with different diseases. And it's not really so much animals coming into contact with us, it's us coming into contact with them in terms of moving into what was their habitat. It's well known with different diseases that as we, for example, with deforestation, developments, urban developments, that really we're moving into an ecosystem which has existed for thousands and millions of years. Those viruses have been there, those bacteria have been there. We call them zoonotic because now they're infecting us, but they've been there for almost ever. So we're introducing ourselves into these ecosystems. And that really is at the heart of a lot of these emerging diseases, that we're just changing these ecosystems, where we're moving into an ecosystem. And the result is, not surprisingly, that we're going to get exposed to these various pathogens. It's almost sort of, it makes sense. You know, it's the obvious. That's what we expect will happen. Coronavirus is a great example. That's what's happened. But it's been happening for a long time.
Right. Dr. Kwak, what are your thoughts on that? Habitat destruction leading eventually to these pandemics for human beings, because we are essentially responsible for, to a great extent, creating changes in the ecosystem.
Right, it does make sense to me as well. But it's another thing is that destruction of ecosystem is already affecting ourselves through not just the animals, but through the man-made byproducts as well. With the bunch of plastics that are killing animals, it is also affecting us eventually, because when we also consume animals for our food, that is eventually coming back to us anyways. So destruction of ecosystem, whether they might be having animals and people come closer physically or not, it's already affecting us in a very destructive way that we have to strongly consider having a stricter management of such happenings. I think we have to be just more careful as to cope with the nature for the better in the future.
Right. You mentioned your 3-year-old toddler earlier on, Dr. Kwak, and we have the free influenza vaccination program currently in place here in the country. Has your child been vaccinated too?
Just not yet, but I plan to do that just tomorrow, actually. I have 3 children who are 3, 5, and 7. They're all going to come into my clinic, actually, and I'm going to give them all the shots. I'm going to see them cry all over right now.
I see. Well, there is much concern here in the country about these flu vaccines. There's also a shortage, I hear, in supply. Could you tell us a bit about that?
Well, I'm not so knowledgeable with the shortage yet, but I see that some local clinics did go short on the vaccinations that were given freely. I think it's going to come back up hopefully within a few days. My hospital is not having any problems with it. I believe other hospitals are not having too much problem with it. I think the stock's going to come back up possibly early next week, and we're not going to have any much problem giving vaccinations to everyone.
Right. Professor Ward, Australia went through its flu season quite well this year around, with many getting themselves vaccinated. What is the current COVID-19 situation in Australia like? Could you briefly tell us, Professor Ward?
Sure, and I just heard today, so that this is one of the silver linings of the COVID-19 pandemic. Our influenza season, very, very few people have died. It's been remarkable. So that's a bright side. The coronavirus situation in Australia is pretty much under control. We had a fairly major outbreak in Melbourne. That has now come under control, as the numbers have been in less than 10, I think, for several weeks now. There's the occasional case. There's small numbers of cases where I am in Sydney and in New South Wales. So in this situation where we just get these small numbers, but it's not going away, we certainly don't have a crisis. We don't have an epidemic. We just have this ongoing, a few cases today, a few cases tomorrow, no cases. It's this long period that now we're deciding where to next. That's sort of the situation we're in.
Right, it's pretty much the situation that the world itself is facing, I'm sure. Professor Dr. Kwak, we are now in the fall season, of course, and there are many who are out there trying to or want to enjoy the fall scenery. Do you have some words of advice for members of the public as they seek to venture outdoors to enjoy a bit of the sunlight and the colors of autumn?
Right. Everyone, as much as I do, want to go out and have the view of the scenery and also interact with each other, possibly because we're getting lower numbers. But the weather is getting colder. We tend to stay inside much more. That means we're going to be able to spread more easily to other people. Let's make sure to keep the 3 W's. always wash your hands, watch the distance, and also wear the mask. It's pretty much the only thing that we can possibly do at this time without any vaccinations or particular treatment for COVID-19. It's the least and probably the only thing that we can do currently to mitigate the spread of the virus even further, to have even lower numbers.
Right, and speaking about masks, there was also some talk here in the country about the importance of wearing the right mask for COVID-19. Could you tell us a bit about that?
That's correct. I also want to emphasize the fact that see-through masks, they are of no use. Do not wear them. If you are going outside for a jog, at least wear KF80. But if you're meeting other people, multiples of people, definitely do wear anything above the level of KF80 or KF94. I strongly suggest KF94 levels.
I see. All right, Dr. Kwok, as always, thank you for your thoughts. And Professor Ward, over in Australia, thank you again for your answers and for taking my impromptu questions as well.
Thank you very much for having me.
All right, well, that brings us to the end of this week's coverage of COVID-19. For those of you seeking to indulge in the sights and sounds of autumn this weekend, do seek also to abide by the simple task of mask wearing to allow your outing, that is, to be safe and pleasant as that of those around you. Have a good weekend. See you next Monday.